Houston, who will now take questions from the room and on the phone. We'll start in the room.
Premier, during the provincial election, there was talk about the province's plans for daycare, and of course everybody alluded to that agreement that the former government signed with the federal Liberals. What concerns, if any, do you have about Aaron O'Toole openly saying that he will cancel those agreements if he forms government?
I haven't paid too close attention to the different federal policy issues, but what I will say is this: is we know that childcare is an important, and the agreement with the federal government that's been signed is something that's of interest to us. So we're going to take a look at that. If there's a new national government, then we'll also be pushing on them to make sure that Nova Scotians are supported and that childcare specifically is focused on. But that'll be part of a broader discussion, including healthcare, childcare, lots of issues around immigration numbers. So there's a lot to be discussed between the province of Nova Scotia and the federal government. And I've always been very clear that I'm beholden to Nova Scotians. My focus is on Nova Scotians and getting the best possible deal with the federal government for Nova Scotians. That will always be in my best interest and ours too.
But would it be your hope that whoever forms the next federal government honors that deal that the province and Ottawa signed?
Unless they're proposing a better deal for Nova Scotians, but it's the best deal for Nova Scotians. That's what I'm most interested in.
Speaking of deals that have previously been signed, what is your government's position on whether or not it will honor the remaining years of the contract with Bay Ferries?
Yeah, I mean, my thoughts on that are on the service performance so far are pretty well known. I mean, it hasn't been successful for Nova Scotians, so we're interested in things that are successful for Nova Scotians. So that means discussions about making sure it's the right port, making sure it's the right boat, making sure the schedule is appropriate. So we'll have all those discussions as to how we can make sure that the arrangement that's being funded by the taxpayers of Nova Scotians works for Nova Scotians. I haven't had those discussions as of yet, but my focus is on making sure that the deal is in the best interest of Nova Scotians.
Do you feel like you need to see at least a year or two's worth of performance out of Bar Harbor before you would consider a change, or are you open to making a change even before that?
I think the first step is to understand from the operator what we can expect in terms of performance. So I really like to talk to them and say what's a reasonable expectation for performance over the next couple of years. I'd like to see where their thoughts are and then kind of go from there. I think definitely they're owed that. Nova Scotians are owed that. We've invested a lot in this service. We haven't seen the return to the taxpayers, but I really want to know what does the business plan look like right now as presented by the operator. And I haven't had those discussions, but that's the first step.
Do you have any concerns about your ability to work with Mr. McDonald after the court challenge that you folks went through?
No.
One other previous government announcement I'd ask you about is what is your government's level of commitment to seeing through the creation of a new art gallery of Nova Scotia?
Oh, we're committed to an art gallery for Nova Scotia. I think it's an important thing. The existing project, like all capital projects, I mean, we need to look at and really understand where we're at on the timeline. I understand it was maybe paused for a little bit, and there's some. But really just understanding the timeline, understanding where we're at in the budget. But I mean, I'm a supporter of the arts. And I think an art gallery is something that's important to Nova Scotians, but in the context of the timeline and the budget.
In your election platform, you talked about how important it was to decentralize decision-making within Nova Scotia Health Authority. How do the changes announced yesterday fit with that?
I'm a big proponent of listening to communities. I believe that communities know what works best for their community. They understand their needs more than people who are away from their community. So I'm a big proponent in mechanisms for local decision making. And the next step is we put a team in place, an action team yesterday, and they have a very clear mandate. We expect action. We expect improvements to access. We have expectations. Those changes will be driven by those on the front lines of healthcare. So the next step is we're going to work our way around the province. listening to frontline healthcare professionals, doctors, nurses, paramedics, CCAs, nurse practitioners. I mean, the list goes on. There's a lot of people providing great service to Nova Scotians and delivering healthcare. We're going to listen to them because they have ideas. So that's the next step. We'll do that tour, that we'll work our way around the province towards the end of the month. We'll look at that feedback, and part of that will include how can your community be best heard? What will give you confidence that the decision makers in healthcare hear and understand your concerns? And so that'll be part of as we work our way around the province.
But if it's still a team of 4 people in Halifax ultimately making the decisions, how does that decentralize decision-making?
I think ultimately you might even go one further and say it's ultimately the premier's, because all these things ultimately fall to me. I was very clear in the election campaign that I'm focused on improving access to healthcare, and I will hold myself to that account. That's how I will judge, in large part, my performance as the premier of this province is very important. But listen, you have to have the mechanism to hear the voices and respect the voices of people across this province, and we will do that. Their voices will be heard, their input will be respected, and then decisions will be made.
Premier, what do you make of the online petition to appoint a person of color to the Minister of African and Nova Scotian Affairs? I know you've been asked about the appointment before, but there seems to be ongoing general concern about this appointment.
Yeah, I understand the emotions. I'm very respectful of the concerns of communities as we talk about. There's a certain reality. The members of my cabinet will be elected officials. That's it, full stop. The members of my cabinet will be elected officials. And I have a caucus of 31 Nova Scotians, community leaders, each and every one of them. I'm very proud of the caucus we have. We also have 24 people who ran for the PC party that were not elected. And that I'm sad by that because there's a number of them that I felt would be. We ran the most diverse slate of candidates, but the people decide. And the people decided on election day, the members of my caucus, that was their decision. I respect their decision. So my cabinet comes from my elected caucus. There are many things we can do in the bureaucracy and take the steps to make sure that the community understands that their voices will be heard, that their concerns will be respected. And we'll always continue to look for ways to do that. But in terms of the very specific question about the cabinet, we have our cabinet.
Is there any consideration of creating or hiring a special advisor who's a person of color to this minister?
Yeah, there's lots of discussions happening right now as to how we best organize the highest levels of government, highest levels of the civil service to make sure that the mechanism is there for voices to be heard, voices to be respected, and I hear their concerns, and I take the concerns of the community very seriously, and we're considering lots of options.
That said, you did remove the deputy minister who was a black person.
Yeah, we made changes to a number of deputies. We have a vision for the province. We've looked very seriously. These are hard decisions. Personnel decisions are very hard because we know there's ramifications, and we made the decisions that we thought were in the best interests of executing on the vision, and it impacted a number of people, and it impacted a number of people yesterday. Many of the ones that were impacted yesterday were volunteers doing volunteer service to the province. So I'm fully aware of the ramifications on people that personnel decisions make, and they're not made lightly, but I make the decisions that I think are in the best interest of the province.
And regarding the announcement yesterday, one of the big criticisms of the Health Authorities Board when it was first appointed was how secretive it was. Meetings weren't open, they didn't make minutes available. Eventually that started to change. How do you ensure openness and transparency to the operation for the public when, in essence, you've got a CEO and a single person for the board who presumably won't have open meetings and won't be publishing minutes?
I think the concern for the delivery of healthcare in this province was actually much broader than how the board met. because people don't have access to a doctor, surgery wait times. They could see the deterioration of healthcare, and they were looking for ways that they could understand why healthcare the deterioration was happening so quickly in this province. And one of the things was they wanted more transparency for the board. For me, my objective is to improve access to healthcare. And once I start to do that, once we start to see some positive momentum forward, then people will be they'll be I guess more content with how things are operating. But openness and transparency are critical to me. So we'll find ways to make sure that people understand decisions that are being made and have an understanding of why they're being made. The board was a part of that, but I mean, if I have great respect for the former CEO of the Health Authority. I'm very, very thankful to those board members who volunteered their time and did what they think was right for healthcare in Nova Scotia. But we have problems in healthcare in Nova Scotia, and I have a very clear mandate from the people of the province to fix it. So we're hitting reset. And we'll make the changes that are necessary, and we'll do them always in the best interest of Nova Scotians, and we'll be open and transparent as we make decisions as to why. And people, my obligation is to make sure that people know that they had a chance to have an impact on them. So we're starting with, as we work our way in the province, specifically with frontline healthcare workers. We'll continue to broaden that to understand the patient experiences. There's lots of patient advocacy groups have reached out to they've reached out to me as well already, and I'm sure through the minister. So we're going to make sure that we make informed decisions. And I hope people have some confidence that that's the way we operate. We started talking about healthcare policy a year ago. We didn't make it up on the back of a campaign bus. We did it by consulting with people, and I have great respect for the consultation process. So people will, my success will be that when people feel that they were consulted with, and we'll do everything we can to make sure that they were.
When it comes to reopening the province, how firm are you on the 75% vaccination rate? And would you change the criteria? Right now it's based on entire population to eligible population.
Always going to take the guidance of Dr. Strang and public health, but to answer your question today, as I sit here, very firm.
So what happens if we don't reach it by September 15th? We just keep staying in phase 4?
Yeah, the 75% is the hurdle that puts us into phase 5. And from all my discussions with public health and Dr. Strang, if that's not met, we don't start phase 5 until it is.
Are there any other hurdles?
That's the most significant one. That's the one I'm focused on. I don't know that there's really any others, but I mean, we've all been Nova Scotians and have all been told that, get vaccinated, and we encourage vaccination. I hope people get out and get their first dose if they don't have it yet. I certainly hope they get out and get their second dose as soon as possible. Vaccination is the key. And the flip side of that is Nova Scotians have been told that when we get vaccinated and when we do our part and we meet a certain hurdle, that certain restrictions will come away, and that hurdle is that 75%, and that's what Dr. Strang has been focused on. Therefore, that's what I've been focused on.
Are there any plans in place to potentially boost the number of like if we get to September 15th and we're still around, we're only at 70 right now. We've barely moved in the last month. So getting, the 4 or 5 extra %, if we don't reach that, is there any plans, anything we can do to boost that number?
Yeah, I think we'll continue to, education, promotion. We'll look at lots of options and more accessibility, more vaccination clinics. These are all things like we're very focused. I know public health is very focused. I share that focus, and Nova Scotians share the focus of getting more and more people vaccinated.
You can try, like we've been educating, we've had public clinics for months. If that hasn't worked by now.
I think you already see some movement in private industry to help spur it along with their own vaccination policies. We're seeing some of the educational institutions try to help move the vaccination rate with their policies. So we'll work with any partners in that respect, but always open to new ideas. And if any Nova Scotian has an idea as to how we can help encourage people to get vaccinated more quickly, we're open to that as well.
We're going to have to go to the phones. We'll go to Canadian Press's Keith Doucette on the phones. Keith, you're up.
Hi, Premier. I'm wondering, there seems to be a growing momentum for vaccine passports, and I know what you said yesterday, that no decision has been made, but we already know what Dr. Strang's philosophy is on this. I'm wondering what your philosophy is. It doesn't mean that you would necessarily cancel one another, but are you flexible in terms of looking at the potential need for this?
Yeah, and just for clarity, when you're talking about knowing Dr. Strang's position on it, are you referring to his where he raised some concerns is about the ethical?
That's correct. During the last, I think the August 23rd briefing, he basically said that it wasn't considered government policy at this point.
Yeah, I mean, look, there's pros and cons to all these things. Every time you make a decision that impacts people, there's always pros and cons. So for me, I still stand firm is that I'm guided by Dr. Strang, guided by the expertise of public health. They have the expertise. They have a good understanding of what's happening in other jurisdictions and the pros and cons of that. So we have a briefing scheduled with Dr. Strang to talk about this very topic and the various ramifications of whatever the outcome. So we'll continue to listen to public health. It's what's got Nova Scotia. We've done well in this province by respecting the expertise of public health, and Nova Scotians have responded to following guidelines, and we'll, as a government, we'll continue to respect public health on that stuff too.
Keith, do you have another question?
No, I'm fine, thanks.
Go back to the room for 2 more minutes.
Premier, you've brought in quite a few people from the former Ham government, which is perhaps understandable. I wonder, though, how that affects, or if that reflects any of your thoughts about the Northern Pulp situation and what your approach to that issue will be moving forward.
Yeah, it doesn't. I mean, it's not a file that I've discussed with anyone really outside of my positions on Northern Pulp haven't changed, and they're the same as my position on every significant environmental application that comes before the province, and there will be many, from pulp mills to gold mining and everything in between. So my position is that the responsibility of the government is to set the standard. What is acceptable to the people? What's safe when you consider the impacts on our natural environment and preserving our planet, and then set that standard, and then set the process to determine whether or not the standard has been met, and then the outcome is the outcome. So I haven't discussed the file with anyone. Waiting for a briefing from the minister on where it actually stands today. But my position is always the same. Set the standard that Nova Scotians are comfortable with, that Nova Scotians are willing to accept, and then determine the process to assess whether that standard has been met or not.
There's a large issue of something like $80 million in outstanding loans. What are your thoughts on that?
Monies that are owed to the province should be paid to the province.
Do you anticipate at some point reestablishing a board for the health authority, or in your view, is that something that's not necessary?
I think in the fullness of time, once we understand governance is critical in every aspect of government and life, really. So I think in the fullness of time, we're going to get to a structure that works. Today, my focus is on improving access. It's very clear that the amalgamation of the health authorities didn't work. The administration costs have gone much higher, and health outcomes have decreased. So we have to find the right structure, and for me, that right structure means having people accountable. That understand they're responsible for making sure there's access. I think people will have seen that with the way I structured the cabinet, where I moved the responsibilities so people are responsible for making sure we're doing what's right in long-term care. We're doing what's right in addictions and mental health. We're doing what's right in primary care. So, and ultimately, the structure will be driven by making sure that the service is there for Nova Scotians. So I'm not predisposed to any existing structure. I want the right structure. I am predisposed to making sure people can access the care they need when they need it, where they need it.
Mr. Premier, one of the last acts of the Liberal cabinet was in ordering council where they topped up the severance for their political staffers after their defeat. We're told it was about $350,000 altogether extra that they paid out. What do you think of that use of public funds?
Yeah, I think, look, there's contracts in place with people working in government, and those contracts should be honored, is my position. The previous government, one of their last orders of business was to move away from the written contracts. That's not something that I would have done.
That's all the time we have for questions for the Premier today. Thank
Thanks,
you,
Premier.
Premier.
Thanks, everyone.